Phlebotomy Certification Test Practice Questions. Question 1. While explaining a venipuncture in the preoperative testing area, which statement is most professional? Option A. You may feel a quick pinch, and I will tell you each step as we go. Option B. I am new, so this might take a long time. Option C. This will not hurt at all. Option D. Do not move or I will have to stick you again. The correct answer is option A. You may feel a quick pinch, and I will tell you each step as we go. A brief, honest explanation prepares the patient without increasing fear. Announcing inexperience shifts worry to the patient instead of focusing on safe care. Promising no pain is unrealistic and may reduce trust. Threatening language is unprofessional and can heighten anxiety. Question 2. In the Oncology Infusion Center, which action best protects confidentiality when discussing a patient's therapeutic drug level order? Option A. Leave the requisition face up in a public waiting area. Option B. Discuss the order only with authorized personnel in a private manner. Option C. Explain the results loudly at the front desk. Option D. Tell a friend that the patient was seen today. The correct answer is option B. Discuss the order only with authorized personnel in a private manner. Confidential information should be shared only for legitimate care purposes and in a private setting. Leaving paperwork visible allows others to see private medical information. Public discussion can expose protected health information. Sharing a patient's visit with a friend is not authorized. Question 3. Before touching collection supplies for a bilirubin, why is hand hygiene required? Option A. It is only needed after visible blood exposure. Option B. It sterilizes the needle after opening. Option C. It reduces transfer of microorganisms between the phlebotomist, patient, and equipment. Option D. It replaces the need for gloves. The correct answer is option C. It reduces transfer of microorganisms between the phlebotomist, patient, and equipment. Hand hygiene is a basic infection control step that lowers the risk of transmitting organisms during care. Waiting until visible blood exposure misses routine opportunities to prevent contamination. Hand hygiene does not sterilize a needle or any sterile device. Gloves are still needed when blood exposure is possible. Question 4. To protect patient safety, which principle guides standard precautions during every phlebotomy encounter in the student skills lab during a mock exam? Option A. Skip precautions for routine outpatient draws. Option B. Use precautions only for patients with known infections. Option C. Wear gloves only when the patient requests them. Option D. Treat all blood and potentially infectious body fluids as capable of transmitting infection. The correct answer is option D. Treat all blood and potentially infectious body fluids as capable of transmitting infection. Standard precautions assume that blood may carry infectious organisms regardless of diagnosis. Routine outpatient draws still involve blood exposure risk. Known infection status is not enough because some infections are undiagnosed. Glove use is based on exposure risk, not patient preference alone. Question 5. After removing gloves following a lactate draw, which step should occur next? Option A. Perform hand hygiene immediately. Option B. Place gloves in the sharps container. Option C. Use the same gloves for the next patient. Option D. Touch the computer keyboard before cleaning hands. The correct answer is option A. Perform hand hygiene immediately. Hand hygiene after glove removal removes organisms that may be present from glove contamination or removal. Gloves belong in regular biohazard waste when contaminated, not in the sharps container. Reusing gloves transfers contamination between patients. Touching shared equipment before hand hygiene can contaminate surfaces. Question 6. In a contact precaution room, which added protection is commonly required before collecting blood in the blood collection station during a practice drill? Option A. Sterile gloves and no gown for all patients. Option B. Gown and gloves according to the isolation signage. Option C. No PPE because blood collection is brief. Option D. Only a surgical mask for every contact patient. The correct answer is option B. Gown and gloves according to the isolation signage. Contact precautions commonly require gown and gloves to prevent transfer of organisms from the patient or environment. Sterile gloves are not required for routine venipuncture unless a sterile procedure is indicated. Brief contact can still contaminate clothing or hands. A surgical mask is not the defining PPE for contact precautions. Question 7. For an airborne isolation patient needing a patient/INR, which respiratory protection is typically required? Option A. No respiratory protection if the draw is under 1 minute. Option B. Only clean exam gloves. Option C. A fit-tested N95 respirator or facility-approved equivalent. Option D. A cloth face covering from home. The correct answer is option C. A fit-tested N95 respirator or facility-approved equivalent. Airborne precautions require respiratory protection capable of filtering airborne particles according to facility policy. Short exposure time does not remove the need for required respiratory protection. Gloves protect hands but do not protect against airborne inhalation. A cloth face covering is not equivalent to an approved respirator for airborne isolation. Question 8. During a droplet precaution blood draw, which PPE item is especially important when close to the patient's face in the hospital unit during morning rounds during a competency review? Option A. No mask if gloves are worn. Option B. Lead apron. Option C. Sterile shoe covers only. Option D. A surgical mask or facility-approved face protection. The correct answer is option D. A surgical mask or facility-approved face protection. Droplet precautions focus on preventing exposure to respiratory droplets during close patient contact. Gloves protect hands but do not replace facial protection. A lead apron protects from radiation, not droplets. Shoe covers alone do not protect mucous membranes from droplets. Question 9. After activating the needle safety device, where should the used needle be placed in the urgent care laboratory during a final review? Option A. Immediately into an approved sharps container. Option B. In the biohazard bag with gauze. Option C. On the tray until the draw is finished. Option D. In a regular trash bag if capped. The correct answer is option A. Immediately into an approved sharps container. Used needles must go directly into a puncture-resistant sharps container to prevent injury. Soft biohazard bags are not designed to contain needles. Leaving a needle on the tray exposes staff and patients to accidental sticks. Regular trash is not puncture-resistant and is unsafe for sharps. Question 10. If a phlebotomist sustains a needle stick during a study session, which action should happen first in the pediatric clinic during a study session? Option A. Ignore it if the patient looks healthy. Option B. Wash the area immediately and follow the facility exposure reporting procedure. Option C. Finish all remaining patients before reporting. Option D. Recap the needle to identify its size. The correct answer is option B. Wash the area immediately and follow the facility exposure reporting procedure. Immediate cleansing and prompt reporting support timely exposure evaluation and follow-up. Appearance does not determine whether a blood-borne pathogen risk exists. Delaying the report can delay medical assessment and documentation. Recapping increases sharps injury risk and is not needed to report the exposure. Question 11. Why should contaminated needles generally not be recapped after venipuncture in the long-term care unit during a structured exam prep drill? Option A. It makes the tourniquet too tight. Option B. It causes all specimens to hemolyze. Option C. Recapping creates a preventable sharps injury risk. Option D. It changes the additive in the tube. The correct answer is option C. Recapping creates a preventable sharps injury risk. Recapping requires bringing the hand back toward the contaminated sharp, which increases needle stick risk. Tourniquet tightness is unrelated to needle recapping. Hemolysis is affected by collection and handling factors, not by recapping alone. Tube additives are not changed by whether a needle is recapped. Question 12. When a sharps container is near the fill line in the mobile collection site, which action is safest? Option A. Continue using it until the lid will not close. Option B. Push the contents down to make space. Option C. Place extra needles in a biohazard bag. Option D. Replace or close it according to facility policy before it becomes overfilled. The correct answer is option D. Replace or close it according to facility policy before it becomes overfilled. Sharps containers must not be overfilled because protruding sharps can cause injury. Waiting until the lid fails creates an avoidable exposure hazard. Pushing contents down places hands near contaminated sharps. Biohazard bags do not provide puncture protection for needles. Question 13. After reviewing the order, which item is an engineering control used to reduce bloodborne pathogen exposure in the emergency department bay during a review? Option A. A safety engineered needle with a protective device. Option B. A longer tourniquet. Option C. A reminder poster only. Option D. A handwritten exposure note. The correct answer is option A. A safety engineered needle with a protective device. Engineering controls isolate or remove the hazard through device design, such as safety needles. Tourniquet length does not protect against needle stick injuries. A poster may educate staff but does not physically control the sharp. A note documents information but does not prevent exposure. Question 14. During a blood spill cleanup, which approach is most appropriate in the physician office lab during a mock exam? Option A. Use bare hands if the spill is small. Option B. Wear proper PPE and use an approved disinfectant according to policy. Option C. Wipe the spill with dry paper towels only. Option D. Ask a patient to avoid the area and leave it. The correct answer is option B. Wear proper PPE and use an approved disinfectant according to policy. Blood spills require PPE and proper disinfection because blood may contain infectious material. Bare hands create direct exposure risk even with small spills. Dry towels alone do not disinfect contaminated surfaces. Leaving the spill exposes others to contamination. Question 15. In a routine phlebotomy scenario, which resource should be checked for safe handling information about a chemical disinfectant in the community health screening event during a skills check? Option A. The tube expiration label only. Option B. The patient's wristband. Option C. The safety data sheet. Option D. The order of draw chart. The correct answer is option C. The safety data sheet. A safety data sheet explains chemical hazards, PPE, storage, and spill response. A tube label may show expiration but not chemical handling instructions. A wristband identifies the patient but gives no chemical safety guidance. An order of draw chart does not address disinfectant hazards. Question 16. Before proceeding with the draw, which vein is usually preferred for routine venipuncture in an adult antecubital area in the preoperative testing area during a practice drill? Option A. Vein on the underside of the wrist. Option B. Basilic vein as the first choice. Option C. Femoral artery. Option D. Median cubital vein. The correct answer is option D. Median cubital vein. The median cubital vein is commonly preferred because it is usually well anchored and less likely to roll. The underside of the wrist has higher risk for nerve or tendon injury. The basilic vein is closer to nerves and arteries and is usually not the first choice. The femoral artery is not a routine venipuncture site for phlebotomists. Question 17. How should the needle bevel generally be positioned when entering a vein in the oncology infusion center during a scenario? Option A, bevel up at an appropriate shallow angle. Option B, flat against the skin without entering. Option C, bevel down at a steep angle. Option D, sideways with the tube already removed. The correct answer is option A. Bevel up at an appropriate shallow angle. A bevel up approach helps the needle enter the vein smoothly and supports blood flow into the collection system. A needle flat against the skin will not properly access the vein. A bevel down steep approach can increase discomfort and may pass through the vein. A sideways needle position is unstable and not standard technique. Question 18. At what angle is a routine venipuncture needle commonly inserted in the dialysis adjacent clinic during a competency review? Option A, parallel under the skin for several inches. Option B, about 15 to 30 degrees. Option C, about 5 degrees for every adult. Option D, about 60 to 90 degrees. The correct answer is option B, about 15 to 30 degrees. A 15 to 30 degree angle is commonly used to enter the vein without going too deep. Advancing parallel for several inches increases tissue trauma and is not standard venipuncture. A very shallow angle may fail to enter the vein or may drag under the skin. A 60 to 90 degree angle is more likely to puncture through the vein. Question 19. Before inserting the needle for a ammonia, why should the selected vein be anchored? Option A. It allows the tourniquet to stay on longer. Option B. It sterilizes the skin. Option C, anchoring stabilizes the vein and reduces rolling during entry. Option D. It replaces the need to cleanse the site. The correct answer is option C. Anchoring stabilizes the vein and reduces rolling during entry. Anchoring stretches the skin and helps keep the vein steady as the needle enters. Anchoring does not justify prolonged tourniquet time. Anchoring does not sterilize skin or remove microorganisms. Skin cleansing is still required before puncture. Question 20. After cleansing a venipuncture site with alcohol, when should the needle be inserted in the occupational health clinic during a study session? Option A. After wiping the area with a used gauze pad. Option B, immediately while the alcohol is wet. Option C. After blowing on the site. Option D. After the site air dries completely. The correct answer is option D. After the site air dries completely. Allowing alcohol to air dry improves antisepsis and reduces stinging and hemolysis risk. Used gauze can reintroduce microorganisms to the puncture site. Puncturing through wet alcohol can sting and may affect specimen quality. Blowing on the site contaminates the cleaned area. Question 21. How long should a tourniquet generally remain in place before it risks hemoconcentration in the blood collection station during a structured exam prep drill? Option A. No longer than about 1 minute. Option B. Only after the patient pumps the fist repeatedly. Option C. At least 5 minutes for every draw. Option D. Until all labels are printed. The correct answer is option A. No longer than about 1 minute. Tourniquet application beyond about 1 minute can concentrate blood components and alter some results. Repeated fist pumping can also contribute to hemoconcentration. 5 minutes is excessive and can distort laboratory values. Administrative delays do not justify prolonged tourniquet use. Question 22. When should the tourniquet be released during routine tube collection in the outpatient clinic during a clinical simulation? Option A. After 5 minutes to improve the specimen. Option B. As soon as blood flow is established and before removing the needle, following policy. Option C. Only after the patient leaves. Option D. Before the needle ever enters the skin in every case. The correct answer is option B. As soon as blood flow is established and before removing the needle, following policy. Releasing the tourniquet once blood flow is established helps reduce hemoconcentration and patient discomfort. Prolonged application does not improve specimen quality. Leaving it on until the patient leaves is unsafe and unnecessary. Removing it before needle entry in every case may make vein access difficult. Question 23. Why should patients avoid repeatedly pumping the fist during venipuncture in the hospital unit during morning rounds during a review? Option A. It guarantees faster clotting in citrate tubes. Option B. It sterilizes the collection site. Option C. It may alter analytes such as potassium through hemoconcentration and muscle activity. Option D. It prevents all hematomas. The correct answer is option C. It may alter analytes such as potassium through hemoconcentration and muscle activity. Repeated fist pumping can change blood composition and affect certain test results. Citrate tubes are anticoagulated and do not rely on patient fist motion. Fist pumping has no antiseptic effect on the skin. Hematoma prevention depends on technique and post-draw pressure, not fist pumping. Question 24. Before proceeding with the draw, which needle gauge is commonly used for routine adult venipuncture with evacuated tubes in the urgent care laboratory during a mock exam? Option A. A lancet designed for heel stick only. Option B. 12-gauge needle. Option C. 30-gauge needle for all adults. Option D. 21 or 22-gauge needle. The correct answer is option D. 21 or 22-gauge needle. A 21 or 22-gauge needle usually provides adequate flow while limiting trauma for routine adult veins. A heel stick lancet is not used for routine venipuncture. A 12-gauge needle is unnecessarily large and traumatic for routine phlebotomy. A 30-gauge needle is too small for standard evacuated tube collection and may slow flow. Question 25. For a patient with a small fragile hand vein, which device may improve control in the pediatric clinic during a skills check? Option A. Winged infusion set with appropriate tube or syringe technique. Option B. Unprotected straight needle used without a holder. Option C. Large bore blood donation needle. Option D. Heel puncture lancet. The correct answer is option A. Winged infusion set with appropriate tube or syringe technique. A winged infusion set offers better control for small or fragile veins when used according to policy. Using an unprotected straight needle without a holder is unsafe and not standard practice. A large bore donation needle is excessive and can injure a small vein. A heel puncture lancet is for dermal puncture, not accessing a hand vein. Question 26. When a butterfly set is used for a coagulation tube, why may a discard tube be needed first in the long-term care unit during a practice drill? Option A. The discard tube replaces patient identification. Option B. The tubing airspace can underfill the citrate tube and disturb the blood to additive ratio. Option C. The discard tube warms the patient's arm. Option D. The discard tube removes EDTA carryover from the skin. The correct answer is option B. The tubing airspace can underfill the citrate tube and disturb the blood to additive ratio. Coagulation testing requires a properly filled citrate tube, and butterfly tubing can contain air that affects fill volume. No tube can replace proper patient identification. A discard tube is not used to warm the arm. EDTA carryover is managed by order of draw, not by removing it from the skin. Question 27. If no blood enters the tube after needle insertion, which action is safest first in the mobile collection site during a scenario? Option A. Leave the needle in place while searching for another vein. Option B. Probe deeply until blood appears. Option C. Gently adjust needle position while staying within policy and patient comfort limits. Option D. Turn the needle in circles under the skin. The correct answer is option C. Gently adjust needle position while staying within policy and patient comfort limits. Small, controlled adjustment may correct positioning without excessive tissue trauma. A needle should not be left in one site while searching elsewhere. Deep probing increases pain, hematoma risk, and nerve injury risk. Rotating the needle under the skin is traumatic and not appropriate. Question 28. A patient reports sharp, electric pain down the arm during needle insertion. What should the phlebotomist do in the emergency department bay during a competency review? Option A. Release pressure only after all tubes are collected. Option B. Advance deeper to pass the nerve. Option C. Ask the patient to ignore it until the tube fills. Option D. Stop the draw, remove the needle safely, and follow facility procedure. The correct answer is option D. Stop the draw, remove the needle safely, and follow facility procedure. Sharp radiating pain can indicate nerve irritation or injury, so the draw should be stopped promptly. Continuing tube collection delays the response to a possible complication. Advancing deeper can worsen nerve injury. Ignoring the symptom places the patient at unnecessary risk. Question 29. During a difficult draw, why should excessive probing be avoided in the physician office lab during a final review? Option A. It increases pain, hematoma risk, and possible nerve or tissue injury. Option B. It prevents the need for patient identification. Option C. It improves all specimen results. Option D. It sterilizes the vein. The correct answer is option A. It increases pain, hematoma risk, and possible nerve or tissue injury. Excessive needle movement can damage tissue and compromise patient safety. Patient identification is always required regardless of draw difficulty. Probing does not improve laboratory accuracy. Needle movement has no sterilizing effect. Question 30. If a vein collapses during evacuated tube collection, which change may help on a redraw in the community health screening event during a study session? Option A. Tell the patient to pump the fist continuously. Option B. Use a smaller tube, syringe, or winged set according to policy. Option C. Use a stronger vacuum tube on the same fragile vein. Option D. Keep the tourniquet on for several minutes. The correct answer is option B. Use a smaller tube, syringe, or winged set according to policy. Reducing vacuum or improving control can help fragile veins tolerate collection. Continuous fist pumping may affect analytes and does not solve vein collapse. A stronger vacuum can worsen collapse. Prolonged tourniquet time can alter results and increase discomfort. Question 31. In a routine phlebotomy scenario, which site should generally be avoided unless specifically approved by policy or provider order in the preoperative testing area during a structured exam prep drill? Option A. A suitable cephalic vein. Option B. A well-palpated median cubital vein. Option C. A foot or ankle vein. Option D. An acceptable dorsal hand vein. The correct answer is option C. A foot or ankle vein. Foot or ankle draws carry higher complication risk and often require special approval. The cephalic vein can be appropriate when assessed carefully. The median cubital vein is a common routine site when suitable. A dorsal hand vein may be acceptable when antecubital veins are unavailable. Question 32. Why should an arm with a dialysis fistula usually be avoided for routine venipuncture in the oncology infusion center during a clinical simulation? Option A. It eliminates the need for a tourniquet. Option B. The blood in that arm has no cells. Option C. All tubes drawn from that arm turn blue. Option D. The fistula must be protected from injury, infection, and altered blood flow. The correct answer is option D. The fistula must be protected from injury, infection, and altered blood flow. A dialysis access site is medically important and should not be used for routine blood collection without specific authorization. Tourniquet decisions do not remove the risk to a fistula. Blood in the arm still contains cells. Tube color is determined by the collection container, not the arm. Question 33. Why is the site of a prior mastectomy often avoided for venipuncture in the dialysis-adjacent clinic during a review? Option A. Lymphatic changes can increase risk for swelling, infection, or complications. Option B. All specimens from that side clot immediately. Option C. The veins always contain arterial blood. Option D. The skin cannot be cleaned. The correct answer is option A. Lymphatic changes can increase risk for swelling, infection, or complications. Mastectomy with lymph node involvement can affect lymph drainage, so the opposite arm is preferred when possible. Specimens do not automatically clot because of collection side. Venous blood does not become arterial because of mastectomy history. The issue is not an inability to cleanse skin. Question 34. When N4 is running in one arm, which collection choice is usually preferred in the student skills lab during a mock exam? Option A. Ignore the 4 because additives prevent contamination. Option B. Use the opposite arm when available and follow facility policy. Option C. Draw above the 4 site while fluid is running. Option D. Collect directly through the 4 tubing without authorization. The correct answer is option B. Use the opposite arm when available and follow facility policy. Using the opposite arm helps prevent dilution or contamination from 4 fluids. Tube additives do not correct 4 fluid contamination. Drawing above a running 4 can contaminate or dilute the specimen. Line draws require authorization and specific procedure. Question 35. For a lactate collection, which finding makes a venipuncture site a poor choice? Option A. A site that allows safe patient positioning. Option B. A vein that is palpable and resilient. Option C. Edema, burns, scarring, or signs of infection at the site. Option D. Clean intact skin over an antecubital vein. The correct answer is option C. Edema, burns, scarring, or signs of infection at the site. Compromised tissue can affect specimen quality and increase patient risk, so another site should be chosen. Safe positioning is desirable for venipuncture. A palpable resilient vein is generally a favorable finding. Clean intact skin supports safe site preparation. Question 36. A swelling begins forming around the puncture site during collection. What should the phlebotomist suspect in the blood collection station during a practice drill? Option A. Normal clot retraction in the vein. Option B. Proper tube mixing. Option C. Successful fasting status. Option D. Hematoma formation. The correct answer is option D. Hematoma formation. Swelling during a draw suggests blood is leaking into surrounding tissue, forming a hematoma. Clot retraction is a laboratory process, not a normal event around an active needle site. Tube mixing happens after collection and does not cause local swelling. Fasting status cannot be determined by puncture site swelling. Question 37. If a hematoma starts to develop during venipuncture, which action is appropriate in the outpatient clinic during a scenario? Option A. Release the tourniquet, remove the needle, and apply pressure. Option B. Ask the patient to bend the elbow tightly. Option C. Continue filling all ordered tubes. Option D. Massage the swollen area vigorously. The correct answer is option A. Release the tourniquet, remove the needle, and apply pressure. Stopping the draw and applying pressure limits further bleeding into the tissue. Bending the elbow can increase bruising and does not provide focused pressure. Continuing the draw can enlarge the hematoma. Vigorous massage can worsen bruising and tissue injury. Question 38. A patient becomes pale and says they feel dizzy during a blood draw. Which response is safest in the hospital unit during morning rounds during a competency review? Option A. Give the patient food before removing the needle. Option B. Stop the draw, remove the needle, lower the patient's head or position safely, and seek help as needed. Option C. Ask the patient to stand up and walk it off. Option D. Leave the needle in while getting more tubes. The correct answer is option B. Stop the draw, remove the needle, lower the patient's head or position safely, and seek help as needed. Dizziness may signal syncope, so the priority is preventing injury and stopping the procedure safely. Food is not the first action while a needle is still in the arm. Standing can lead to a fall. Leaving the needle in place while symptoms progress increases injury risk. Question 39. After drawing a patient who takes anticoagulants, what post-puncture step is especially important in the urgent care laboratory during a final review? Option A. Use the same bandage time for every patient without checking. Option B. Skip pressure to avoid bruising. Option C. Apply firm pressure longer and verify bleeding has stopped before bandaging. Option D. Ask the patient to bend the elbow sharply. The correct answer is option C. Apply firm pressure longer and verify bleeding has stopped before bandaging. Patients on anticoagulants may bleed longer, so pressure and reassessment help prevent continued bleeding or bruising. A fixed time without checking may miss ongoing bleeding. Skipping pressure increases bleeding risk. Bending the elbow can promote bruising instead of controlled pressure. Question 40. Before proceeding with the draw, which action helps prevent a hematoma after removing the needle in the pediatric clinic during a study session? Option A. Remove the needle before releasing the tourniquet every time. Option B. Have the patient bend the elbow tightly. Option C. Rub the puncture site to spread the blood. Option D. Apply clean gauze with firm pressure while the arm remains straight. The correct answer is option D. Apply clean gauze with firm pressure while the arm remains straight. Focused pressure with the arm straight helps seal the puncture site and limit bruising. The tourniquet should be released before needle removal to reduce pressure in the vein. Bending the elbow may increase leakage into tissue. Rubbing can disrupt clot formation and worsen bruising. Question 41. Bright red pulsating blood appears unexpectedly during a draw. Which concern should the phlebotomist consider in the long-term care unit during a structured exam prep drill? Option A. Possible arterial puncture. Option B. Normal capillary refill. Option C. Proper venous flow. Option D. Tube additive carryover. The correct answer is option A. Possible arterial puncture. Pulsating bright red blood can indicate arterial access and requires stopping the procedure and applying pressure. Capillary refill is assessed in tissue color return, not tube blood flow. Typical venous flow is darker and not pulsatile. Additive carryover affects specimen chemistry, not blood pulsation. Question 42. In the mobile collection site, which tube is collected first when blood cultures are ordered with other venipuncture tubes? Option A. Serum separator tube. Option B. Blood culture bottles or sterile culture tube. Option C. Lavender EDTA tube. Option D. Gray fluoride tube. The correct answer is option B. Blood culture bottles or sterile culture tube. Blood cultures are collected first to reduce contamination of the sterile specimen. Serum separator tubes do not take priority over sterile blood culture collection. EDTA tubes are collected later to prevent additive carryover. Gray tubes are generally collected after other additive tubes. Question 43. In the standard venipuncture order of draw, which tube usually follows blood cultures in the emergency department bay during a review? Option A. Royal blue tube for every test. Option B. Lavender EDTA tube. Option C. Light blue sodium citrate tube. Option D. Gray fluoride tube. The correct answer is option C. Light blue sodium citrate tube. The light blue citrate tube is collected early to protect coagulation testing from additive contamination. Royal blue tubes are used for specific trace element testing, not as the universal second tube. EDTA is collected later because it can interfere with coagulation and chemistry tests. Gray fluoride tubes are usually near the end of the order. Question 44. To protect patient safety, which order is most appropriate for collecting blood cultures? Light blue, serum, green, lavender, and gray tubes in the physician office lab during a mock exam? Option A serum, lavender, blood cultures, gray, light blue, green. Option B lavender, gray, green, serum, light blue, blood cultures. Option C gray, lavender, green, serum, light blue, blood cultures. Option D blood cultures, light blue, serum, green, lavender, gray. The correct answer is option D. Blood cultures, light blue, serum, green, lavender, gray. The standard order minimizes additive carryover by collecting sterile cultures first, citrate early, then serum, heparin, EDTA, and glycolytic inhibitor tubes. Placing cultures after non-sterile tubes increases contamination risk. Starting with lavender risks EDTA contamination of later tubes. Starting with gray places fluoride/oxalate before tubes that could be affected by carryover. Question 45. Why does order of draw matter during evacuated tube collection in the community health screening event during a skills check? Option A. It helps prevent additive carryover from altering later specimens. Option B. It determines the patient's fasting status. Option C. It makes patient identification optional. Option D. It eliminates the need to mix tubes. The correct answer is option A. It helps prevent additive carryover from altering later specimens. Additives from one tube can contaminate another tube if collection order is incorrect. Fasting status is based on patient preparation, not tube sequence. Patient identification is required regardless of tube order. Additive tubes still need proper mixing after filling. Question 46. During capillary puncture, which specimen type is generally collected first when ordered in the preoperative testing area during a practice drill? Option A non-additive tube after all others. Option B blood gas specimen. Option C serum specimen. Option D gray top microtube. The correct answer is option B. Blood gas specimen. Capillary specimens are collected in an order that protects tests most affected by clotting and air exposure, with blood gases first when required. Non-additive tubes are not automatically collected first in capillary order. Serum is not first when blood gases are ordered. Gray microtubes are collected after more time-sensitive capillary specimens. Question 47. In a routine phlebotomy scenario, which capillary collection order is commonly used after blood gases when EDTA testing is ordered in the Oncology Infusion Center during a scenario? Option A. Any order because capillary tubes have no additives. Option B serum microtube before EDTA for every draw. Option C EDTA microtube before other additive and serum microtubes. Option D gray microtube first even when blood gases are needed. The correct answer is option C. EDTA microtube before other additive and serum microtubes. EDTA microtubes are collected early in capillary collection to reduce clotting in hematology specimens. Many capillary tubes contain additives, so order still matters. Serum first collection can allow clotting before the EDTA specimen is filled. Blood gases are more time sensitive and generally come first if ordered. Question 48. Before proceeding with the draw, which tube is most appropriate for a routine CBC in the dialysis adjacent clinic during a competency review? Option A red no additive tube. Option B light blue sodium citrate tube. Option C gray sodium fluoride tube. Option D lavender top tube containing EDTA. The correct answer is option D. Lavender top tube containing EDTA. EDTA preserves cellular morphology and prevents clotting for hematology testing such as CBC. A red tube allows serum testing and is not the standard choice for CBC. Citrate is used mainly for coagulation testing. Gray tubes are commonly used for glucose or lactate preservation. Question 49. During a final review, which additive is found in a light blue tube used for patient and APTT testing in the student skills lab during a final review? Option A, sodium citrate. Option B, lithium heparin. Option C, EDTA. Option D, sodium fluoride with potassium oxalate. The correct answer is option A, sodium citrate. Sodium citrate binds calcium in a controlled ratio so coagulation testing can be performed accurately. Heparin is used for plasma chemistry tests rather than routine patient or APTT tubes. EDTA is used mainly for hematology and can interfere with coagulation testing. Fluoride/oxalate is used mainly to preserve glucose or lactate. Question 50. In the occupational health clinic, which tube is commonly selected for many serum chemistry tests when gel separation is desired? Option A, gray fluoride tube only. Option B, serum separator tube with clot activator and gel. Option C, lavender EDTA tube. Option D, light blue citrate tube. The correct answer is option B, serum separator tube with clot activator and gel. A serum separator tube allows clotting and then separates serum from cells using gel after centrifugation. Gray tubes preserve glucose but are not the general serum separator choice. EDTA plasma is not serum and can interfere with some chemistry tests. Citrate plasma is intended primarily for coagulation testing. Question 51. For a CBC collection, which tube is commonly associated with heparinized plasma chemistry testing? Option A, pink top tube. Option B, lavender top tube. Option C, green top tube. Option D, light blue top tube. The correct answer is option C, green top tube. Green top tubes commonly contain heparin, which prevents clotting and provides plasma for chemistry testing. Pink tubes contain EDTA and are commonly used for blood bank testing. Lavender tubes contain EDTA for hematology. Light blue tubes contain citrate for coagulation testing. Question 52. To protect patient safety, which tube is most commonly used for glucose preservation when testing may be delayed in the outpatient clinic during a clinical simulation? Option A, blood culture bottle. Option B, plain red tube only. Option C, light blue citrate tube. Option D, gray top tube with sodium fluoride and an anticoagulant. The correct answer is option D, gray top tube with sodium fluoride and an anticoagulant. Sodium fluoride inhibits glycolysis, helping preserve glucose concentration before analysis. Blood culture bottles are for detecting microorganisms, not preserving glucose. A plain red tube does not contain glycolysis inhibitor. Citrate is used for coagulation studies, not routine glucose preservation. Question 53. After reviewing the order, which tube is commonly used for blood bank testing such as type and screen in the hospital unit during morning rounds during a review? Option A, pink top EDTA tube. Option B, green heparin tube for every blood bank test. Option C, gray top fluoride tube. Option D, light blue citrate tube. The correct answer is option A, pink top EDTA tube. Pink top EDTA tubes are commonly used for blood bank specimens because they preserve cells and prevent clotting. Green heparin tubes are not the routine tube for type and screen. Gray tubes are associated with glucose or lactate preservation. Light blue citrate tubes are for coagulation testing. Question 54. When preparing for collection, which tube is generally collected for a blood culture specimen in the urgent care laboratory during a mock exam? Option A, SST after clotting. Option B, sterile blood culture bottle or SBS containing culture tube according to policy. Option C, lavender EDTA tube only. Option D, gray fluoride tube. The correct answer is option B, sterile blood culture bottle or SBS containing culture tube according to policy. Blood cultures require sterile collection into a culture system designed to support organism recovery. An SST is for serum separation, not microorganism culture. A lavender tube is not designed as the primary blood culture container. A gray tube preserves glucose and does not support blood culture protocols. Question 55. Why must a light blue citrate tube be filled to the proper level in the pediatric clinic during a skills check? Option A. Serum cannot clot unless the tube is full. Option B. The tube color changes if underfilled. Option C. The blood to anticoagulant ratio must be correct for coagulation results. Option D. EDTA needs extra room to mix. The correct answer is option C. The blood to anticoagulant ratio must be correct for coagulation results. Coagulation testing depends on a precise citrate to blood ratio, commonly described as 1 part citrate to 9 parts blood. Light blue tubes contain anticoagulant and are not collected to obtain serum clotting. Tube color does not change to warn of underfilling. EDTA is not the additive in a light blue citrate tube. Question 56. After collecting an additive tube, how should it usually be mixed in the long-term care unit during a practice drill? Option A. Open the stopper and stir with a wooden applicator. Option B. Shake it hard until bubbles appear. Option C. Leave it unmixed until centrifugation. Option D. Gently invert the tube the recommended number of times. The correct answer is option D. Gently invert the tube the recommended number of times. Gentle inversion evenly distributes additive while reducing cell trauma. Opening a tube risks exposure, contamination, and specimen loss. Vigorous shaking can cause hemolysis. Failure to mix can allow clotting or poor additive action. Question 57. During a scenario, which problem can occur if a lavender EDTA tube is not mixed soon after filling in the mobile collection site during a scenario? Option A. Microclots may form and make hematology results unreliable. Option B. The sodium citrate ratio improves. Option C. The tube becomes sterile for culture. Option D. The specimen turns into serum. The correct answer is option A. Microclots may form and make hematology results unreliable. EDTA must contact the blood promptly to prevent clot formation in hematology specimens. Sodium citrate is not the additive in a lavender EDTA tube. Mixing does not create sterility for culture testing. A lavender tube is intended for anticoagulated whole blood or plasma, not serum. Question 58. In the emergency department bay, which practice helps reduce hemolysis during a routine troponin collection? Option A. Pull back a syringe plunger as hard as possible. Option B. Use appropriate needle size and gently invert tubes instead of shaking them. Option C. Force blood rapidly through a small needle. Option D. Shake additive tubes vigorously. The correct answer is option B. Use appropriate needle size and gently invert tubes instead of shaking them. Gentle handling and appropriate equipment reduce red blood cell rupture. Excessive syringe force can rupture cells and compromise results. Forcing blood through a small needle can damage cells. Vigorous shaking is a common cause of hemolysis. Question 59. For a thyroid panel collection, which laboratory result is especially affected by hemolysis because red cells release intracellular contents? Option A. Tourniquet pressure becomes lower. Option B. Patient date of birth becomes invalid. Option C. Potassium may be falsely increased. Option D. Tube expiration date is extended. The correct answer is option C. Potassium may be falsely increased. Hemolysis releases intracellular potassium from red blood cells and can falsely elevate measured potassium. Tourniquet pressure is unrelated to the analyzer result after hemolysis. Patient demographics are not changed by cell rupture. A specimen problem cannot extend tube expiration. Question 60. When using a syringe for blood transfer, which method best protects specimen quality in the community health screening event during a study session? Option A. Shake each tube hard to remove clots. Option B. Remove the tube stopper and push blood in forcefully. Option C. Squirt blood through the needle into each tube. Option D. Use a safety transfer device and allow blood to flow gently into tubes. The correct answer is option D. Use a safety transfer device and allow blood to flow gently into tubes. A safety transfer device reduces needle stick risk and minimizes pressure-related cell damage. Shaking tubes can rupture cells and worsen specimen quality. Removing stoppers increases exposure and contamination risk. Pushing blood through a needle can cause hemolysis and Sharp's injury. Question 61. Why should alcohol be allowed to dry before puncture in the preoperative testing area during a structured exam prep drill? Option A. Wet alcohol can cause stinging and may contribute to hemolysis or specimen contamination. Option B. Alcohol drying replaces tourniquet use. Option C. Dry alcohol makes the tube additive stronger. Option D. Wet alcohol improves vein anchoring. The correct answer is option A. Wet alcohol can cause stinging and may contribute to hemolysis or specimen contamination. Air drying supports proper antisepsis and prevents wet alcohol from entering the specimen path. Tourniquet use is a separate step for vein distension. Drying does not change the chemical strength of tube additives. Vein anchoring depends on hand technique, not wet alcohol. Question 62. When preparing for collection, which specimen often requires protection from light after collection in the Oncology Infusion Center during a clinical simulation? Option A. Blood culture bottle during incubation. Option B. Bilirubin specimen. Option C. CBC specimen for platelet count. Option D. Routine sodium citrate coagulation tube. The correct answer is option B. Bilirubin specimen. Bilirubin is light sensitive and may decrease if the specimen is exposed to light. Blood cultures require sterile handling and incubation, not wrapping for light protection as the primary step. CBC specimens require mixing and timely testing, not routine light protection for platelet count. Citrate coagulation specimens require correct fill and processing, not light protection as the key issue. Question 63. In a routine phlebotomy scenario, which specimen commonly requires rapid transport on ice or chilled handling according to policy in the dialysis adjacent clinic during a review? Option A. Blood culture bottle placed in the freezer. Option B. Routine CBC kept for the next day. Option C. Ammonia specimen. Option D. Serum separator tube for a lipid panel after clotting only. The correct answer is option C. Ammonia specimen. Ammonia specimens are time-sensitive and commonly require chilling and prompt processing. Blood culture bottles should not be frozen because organisms must remain viable for detection. A routine CBC should not simply be held for the next day without stability guidance. A lipid panel does not share the same immediate chilled handling requirement as ammonia. Question 64. Before proceeding with the draw, which action best maintains specimen integrity during transport to the laboratory in the student skills lab during a mock exam? Option A. Place all blood specimens in direct sunlight. Option B. Store every specimen at room temperature overnight. Option C. Centrifuge every tube immediately regardless of type. Option D. Follow required time, temperature, light, and handling instructions for the ordered test. The correct answer is option D. Follow required time, temperature, light, and handling instructions for the ordered test. Different tests have specific stability requirements, so handling must match the test and facility policy. Sunlight can degrade light-sensitive analytes and warm specimens. Overnight room temperature storage can make many specimens unacceptable. Some tubes should not be centrifuged immediately or at all before required steps. Question 65. If a specimen must be transported cold, which approach is appropriate in the occupational health clinic during a skills check? Option A. Place the specimen in the approved cooling method without direct water contamination. Option B. Place it near a heater until pickup. Option C. Submerge the tube in loose ice water. Option D. Hold it in a bare hand to keep it visible. The correct answer is option A. Place the specimen in the approved cooling method without direct water contamination. Cooling must preserve the required temperature while protecting the label and tube from contamination or leakage. A heater can destabilize temperature-sensitive analytes. Loose ice water can damage labels and create contamination issues. Holding the specimen warms it and defeats the cold requirement. Question 66. In the blood collection station, which situation is a common reason for specimen rejection? Option A, tube was labeled at the bedside. Option B, wrong tube type or insufficient specimen volume. Option C, collector wore gloves. Option D, patient stated date of birth. The correct answer is option B. Wrong tube type or insufficient specimen volume. Wrong container choice or inadequate volume can prevent accurate testing and may require recollection. Bedside labeling is the correct practice. Wearing gloves is expected when blood exposure is possible. Patient-stated identifiers support accurate identification. Question 67. Why should tube expiration dates be checked before collection in the outpatient clinic during a scenario? Option A, expired tubes are required for coagulation testing. Option B, expired tubes identify patients faster. Option C, expired tubes may have inadequate vacuum or unreliable additive performance. Option D, expired tubes prevent hemolysis in every case. The correct answer is option C. Expired tubes may have inadequate vacuum or unreliable additive performance. Tube vacuum and additive quality can decline after expiration, compromising specimen volume or test accuracy. Coagulation testing requires properly filled, unexpired citrate tubes. Expiration dates do not help verify identity. No expired tube can guarantee hemolysis prevention. Question 68. A patient scheduled for a fasting lipid panel says they ate breakfast. Which action is best in the hospital unit during morning rounds during a competency review? Option A, cancel every test without notifying anyone. Option B, draw the specimen and write fasting on the label. Option C, tell the patient not to mention the meal. Option D, follow facility policy by notifying the appropriate person and documenting or rescheduling as directed. The correct answer is option D. Follow facility policy by notifying the appropriate person and documenting or rescheduling as directed. Fasting status affects certain tests, so the discrepancy must be handled through policy and communication. Canceling without communication may disrupt care and exceed the phlebotomist's role. Marking the specimen as fasting would be inaccurate documentation. Hiding the meal prevents proper interpretation of results. Question 69. Why is fasting status important before some chemistry tests in the urgent care laboratory during a final review? Option A, food intake can alter analytes such as glucose or lipids. Option B, fasting eliminates the need for tube mixing. Option C, food changes the patient's legal name. Option D, fasting makes needles sterile. The correct answer is option A. Food intake can alter analytes such as glucose or lipids. Some blood values vary after eating, so fasting helps standardize interpretation. Additive tubes still require proper mixing regardless of fasting status. Food intake does not affect patient identity. Sterility comes from equipment and technique, not fasting. Question 70. For a medication trough level, when is the specimen usually collected in the pediatric clinic during a study session? Option A. Only after the medication is discontinued for a week. Option B, immediately before the next scheduled dose. Option C, immediately after the medication is swallowed. Option D. At any random time during the day. The correct answer is option B. Immediately before the next scheduled dose. A trough measures the lowest drug concentration, typically just before the next dose. Stopping medication for a week is not the routine way to collect a trough. Immediately after dosing reflects absorption or peak timing, not trough. Random timing can make therapeutic drug results difficult to interpret. Question 71. During a glucose tolerance test, why must collection times be followed carefully in the long-term care unit during a structured exam prep drill? Option A. The patient should eat between timed draws to stay comfortable. Option B. Any time is acceptable if the tubes are gray. Option C. Timed results show how the body responds to a measured glucose dose. Option D. Timing only matters after the last tube. The correct answer is option C. Timed results show how the body responds to a measured glucose dose. Glucose tolerance testing depends on comparing specimens at specific intervals after glucose administration. Eating during the test can invalidate the glucose response pattern. Tube type does not remove the need for precise timing. Every scheduled interval matters for interpretation. Question 72. Before proceeding with the draw, which documentation is especially important for a timed specimen in the mobile collection site during a clinical simulation? Option A. A note saying collected sometime today. Option B. The phlebotomist's favorite tube brand. Option C. Only the patient's room number. Option D. Exact collection time recorded on the label or requisition according to policy. The correct answer is option D. Exact collection time recorded on the label or requisition according to policy. Timed tests require accurate collection time so results can be interpreted correctly. Vague timing can make the specimen clinically unreliable. Tube brand does not communicate timing. Room number is not a valid substitute for collection time. Question 73. Before collecting blood cultures, why is careful skin antisepsis critical in the emergency department bay during a review? Option A. It reduces contamination that could cause a false positive culture. Option B. It changes venous blood into arterial blood. Option C. It makes EDTA tubes clot faster. Option D. It eliminates the need for sterile bottles. The correct answer is option A. It reduces contamination that could cause a false positive culture. Blood cultures are highly sensitive to skin organisms, so antisepsis helps ensure organisms detected are clinically meaningful. Skin antisepsis does not change the type of blood collected. EDTA clotting is unrelated to culture site preparation. Sterile collection containers are still required. Question 74. When collecting blood cultures with other tubes, which priority is most important in the physician office lab during a mock exam? Option A. Use a non-sterile transfer cup. Option B. Maintain sterility and collect cultures before non-sterile tubes. Option C. Collect cultures after gray tubes. Option D. Touch the bottle tops after cleaning to confirm dryness. The correct answer is option B. Maintain sterility and collect cultures before non-sterile tubes. Blood cultures must be protected from contamination because false positives can lead to unnecessary treatment. A non-sterile transfer process defeats the purpose of sterile collection. Collecting cultures after other tubes increases contamination risk. Touching clean tops can recontaminate them. Question 75. If using a winged set for blood cultures, why is bottle order guided by facility policy in the community health screening event during a skills check? Option A. The order makes the needle reusable. Option B. The order determines the patient's identity. Option C. Air in the tubing can affect which bottle should be filled first. Option D. The order prevents the need to clean the site. The correct answer is option C. Air in the tubing can affect which bottle should be filled first. Butterfly tubing contains air, and culture bottle order may be chosen to manage that air safely. Needles are single-use and cannot be reused. Bottle order does not verify patient identity. Skin and bottle antisepsis are still required. Question 76. For illegal blood alcohol collection, which requirement is especially important in the preoperative testing area during a practice drill? Option A. Let the patient carry the open tube to the lab. Option B. Use alcohol swabs for every blood alcohol specimen. Option C. Leave the specimen unlabeled until court. Option D. Maintain chain of custody documentation and use the required non-alcohol antiseptic if specified. The correct answer is option D. Maintain chain of custody documentation and use the required non-alcohol antiseptic if specified. Legal specimens require strict identity, handling, and documentation controls to preserve admissibility and integrity. Allowing the patient to carry an open specimen compromises custody and security. Alcohol antiseptic may contaminate alcohol testing and may be prohibited by protocol. Unlabeled legal specimens break traceability. Question 77. After reviewing the order, which action best supports chain of custody for a drug screen specimen in the oncology infusion center during a scenario? Option A. Document each person who handles the specimen from collection to transfer. Option B. Discard the seal after collection. Option C. Use only verbal handoff with no signatures. Option D. Store the specimen in an unlocked public area. The correct answer is option A. Document each person who handles the specimen from collection to transfer. Chain of custody proves who had control of the specimen at each step. A broken or discarded seal weakens evidence of tamper control. Verbal handoff alone does not create a traceable legal record. Unsecured storage can compromise specimen integrity. Question 78. Why are tamper-evident seals used on forensic or workplace testing specimens in the dialysis-adjacent clinic during a competency review? Option A. They prevent the need for a requisition. Option B. They help show whether the specimen was opened or altered after collection. Option C. They replace patient consent. Option D. They make refrigeration unnecessary for all tests. The correct answer is option B. They help show whether the specimen was opened or altered after collection. Tamper-evident seals support specimen integrity by making unauthorized opening visible. A requisition or custody form is still needed for proper processing. A seal does not replace required consent or authorization. Temperature requirements still depend on the test. Question 79. For an infant heel stick, which area is safest for puncture in the student skills lab during a final review? Option A. Tip of the great toe. Option B. Posterior curvature of the heel. Option C. Medial or lateral plantar surface of the heel. Option D. Center of the arch. The correct answer is option C. Medial or lateral plantar surface of the heel. The medial or lateral plantar heel avoids deeper structures when an appropriate lancet depth is used. The great toe is not the standard infant heel stick site. The posterior curvature increases risk of bone injury. The arch is not an approved heel stick site. Question 80. Why should an infant heel puncture not be too deep in the occupational health clinic during a study session? Option A. A deep puncture replaces the need for warming. Option B. A deeper puncture always prevents hemolysis. Option C. Depth determines the tube color. Option D. Excessive depth can injure bone or deeper tissue. The correct answer is option D. Excessive depth can injure bone or deeper tissue. Infants have small heels, and excessive lancet depth can damage underlying structures. Warming is a separate step used to improve blood flow when appropriate. Deeper puncture can increase injury and does not guarantee specimen quality. Tube color is selected by test requirements, not puncture depth. Question 81. During a structured exam prep drill, which finger is generally preferred for adult capillary puncture in the blood collection station during a structured exam prep drill? Option A. Middle or ring finger on the palmar surface near the side of the fingertip. Option B. Little finger near the bone. Option C. Thumb pad for every test. Option D. Index fingertip in all adults. The correct answer is option A. Middle or ring finger on the palmar surface near the side of the fingertip. The middle or ring finger usually has adequate tissue and less callus than other fingers. The little finger has less tissue over bone and higher injury risk. The thumb may be more calloused and is not the routine first choice. The index finger is often more sensitive and calloused. Question 82. After a finger puncture, why is the first drop of blood commonly wiped away in the outpatient clinic during a clinical simulation? Option A. It activates the tube vacuum. Option B. It may contain tissue fluid or contaminants that can affect the specimen. Option C. It contains only white blood cells. Option D. It proves the patient is fasting. The correct answer is option B. It may contain tissue fluid or contaminants that can affect the specimen. The first drop can be diluted with tissue fluid or skin contaminants, so wiping it improves specimen quality for many tests. Capillary collection does not depend on evacuated tube vacuum at the puncture site. The first drop is not composed only of white blood cells. Fasting status cannot be determined from the first drop. Question 83. How can warming a capillary puncture site help collection in the hospital unit during morning rounds during a review? Option A. It makes every specimen suitable for culture. Option B. It sterilizes the skin completely. Option C. It increases local blood flow when used safely. Option D. It removes the need to identify the patient. The correct answer is option C. It increases local blood flow when used safely. Warmth can improve capillary blood flow and reduce the need for excessive squeezing. Capillary specimens are not automatically suitable for blood culture collection. Warming does not sterilize skin. Patient identification is still mandatory. Question 84. Why should excessive squeezing or milking be avoided during capillary collection in the urgent care laboratory during a mock exam? Option A. It prevents clotting in serum tubes. Option B. It improves all glucose results. Option C. It makes EDTA unnecessary. Option D. It can dilute the specimen with tissue fluid and cause hemolysis. The correct answer is option D. It can dilute the specimen with tissue fluid and cause hemolysis. Excessive pressure can alter specimen composition and damage cells. Serum tubes are intended to clot and are not protected by squeezing. Glucose results can be affected by poor specimen quality rather than improved. EDTA is still needed when an EDTA microtube is required. Question 85. When is dermal puncture commonly preferred over venipuncture in the pediatric clinic during a skills check? Option A. For some infants, small volume tests, or patients with difficult veins when appropriate. Option B. Whenever patient identification is incomplete. Option C. For every blood culture set. Option D. For all coagulation studies regardless of policy. The correct answer is option A. For some infants, small volume tests, or patients with difficult veins when appropriate. Dermal puncture can be useful when only small volumes are needed or venipuncture is difficult. Incomplete identification must be resolved before any collection method. Blood cultures usually require sterile venipuncture collection and adequate volume. Coagulation testing has strict specimen requirements and is not automatically dermal. Question 86. A child begins to pull away during a draw. Which action supports safety in the long-term care unit during a practice drill? Option A. Ask another child to hold the arm. Option B. Pause if needed and obtain appropriate assistance for safe positioning according to policy. Option C. Continue while the arm is moving. Option D. Scold the child until they stop. The correct answer is option B. Pause if needed and obtain appropriate assistance for safe positioning according to policy. Safe positioning prevents sudden movement that could injure the child or phlebotomist. Another child is not appropriate assistance for a procedure. Continuing while the arm moves increases injury risk. Scolding is not therapeutic and can escalate fear. Question 87. In a routine phlebotomy scenario, which explanation is best for a young child before a finger stick in the mobile collection site during a scenario? Option A, promise a toy only if they do not cry. Option B, tell the child nothing will happen. Option C, use simple honest words such as a quick pinch and explain what they can do to help. Option D, use detailed adult medical terminology. The correct answer is option C. Use simple honest words such as a quick pinch and explain what they can do to help. Age-appropriate honesty helps the child understand and cooperate without unnecessary fear. Tying a reward to not crying can shame a normal fear response. Saying nothing will happen is misleading. Complex terminology can confuse or frighten a young child. Question 88. For an older adult with fragile veins, which technique is most appropriate in the emergency department bay during a competency review? Option A, leave the tourniquet on for several minutes. Option B, slap the site hard to make veins appear. Option C, use the largest needle available. Option D, use gentle anchoring and consider a smaller needle or controlled collection device. The correct answer is option D. Use gentle anchoring and consider a smaller needle or controlled collection device. Fragile veins need careful stabilization and equipment that reduces trauma or collapse. Prolonged tourniquet time increases hemoconcentration and bruising risk. Slapping can injure delicate skin and is unprofessional. A large needle can worsen trauma. Question 89. Why should adhesive bandages be used carefully on some older adults in the physician office lab during a final review? Option A, fragile skin can tear when adhesive is removed. Option B, bandages prevent all anticoagulant bleeding. Option C, adhesive changes the blood type. Option D, older adults never need pressure after draws. The correct answer is option A. Fragile skin can tear when adhesive is removed. Aging skin may be thin and easily damaged, so pressure wrap or gentle dressing choices may be needed. A bandage does not eliminate bleeding risk, especially with anticoagulants. Adhesive has no effect on blood type. Older adults still need pressure until bleeding stops. Question 90. Before assembling equipment for a hemoglobin A1C draw, which item should be checked? Option A. The brand of wall clock in the room. Option B, tube type, expiration date, needle safety device, and requisition requirements. Option C. Only the color of the chair. Option D. The patient's favorite beverage. The correct answer is option B. Tube type, expiration date, needle safety device, and requisition requirements. Checking supplies before collection helps prevent wrong container use, expired tubes, and safety device problems. The wall clock brand does not confirm correct supplies or orders. Chair color has no role in specimen acceptability. Favorite beverage is not part of collection equipment verification. Question 91. For a electrolyte panel collection, which sequence is safest after blood has entered the final tube? Option A, remove the needle and recap it before pressure. Option B, withdraw needle with tourniquet tight and no gauze ready. Option C, release tourniquet, remove tube, place gauze, withdraw needle, activate safety device, apply pressure. Option D, activate safety device before removing the needle from the arm. The correct answer is option C. Release tourniquet, remove tube, place gauze, withdraw needle, activate safety device, apply pressure. The final steps should reduce venous pressure, prepare for bleeding control, and secure the sharp immediately. Recapping a contaminated needle creates sharp's injury risk. Withdrawing with the tourniquet tight can increase bleeding and bruising. Most safety devices are activated after withdrawal unless the device instructions say otherwise. Question 92. To protect patient safety, which action should occur before leaving the patient after venipuncture in the Oncology Infusion Center during a clinical simulation? Option A, dispose of sharps after walking to another room. Option B, leave while blood is still oozing. Option C, tell the patient to remove the bandage immediately. Option D. Confirm bleeding has stopped and provide appropriate post-draw instructions. The correct answer is option D. Confirm bleeding has stopped and provide appropriate post-draw instructions. Post-draw assessment helps prevent bleeding, bruising, and delayed complications. Sharps must be disposed of promptly in the collection area. Leaving active bleeding unattended is unsafe. Immediate bandage removal can restart bleeding. Question 93. Why is patient positioning important before venipuncture in the dialysis adjacent clinic during a review? Option A. It reduces the risk of falls or injury if the patient becomes dizzy. Option B. It allows the needle to be reused safely. Option C. It makes labeling unnecessary. Option D. It changes EDTA into citrate. The correct answer is option A. It reduces the risk of falls or injury if the patient becomes dizzy. A seated or lying position with arm support protects the patient if syncope occurs. Needles are single-use and cannot be reused. Proper positioning does not replace specimen labeling. Body position does not change tube additives. Question 94. When preparing for collection, which patient instruction is appropriate after a routine venipuncture in the student skills lab during a mock exam? Option A. Bend the elbow tightly for 10 minutes. Option B. Keep pressure on the site and avoid heavy lifting with that arm for a short time if advised. Option C. Scratch the site if it feels itchy. Option D. Remove the bandage while still bleeding. The correct answer is option B. Keep pressure on the site and avoid heavy lifting with that arm for a short time if advised. Post-draw instructions support clot formation and reduce bruising or bleeding. Bending the elbow tightly can increase bruising. Scratching can disrupt the site and introduce contamination. Removing a bandage during bleeding can restart or worsen bleeding. Question 95. In a routine phlebotomy scenario, which laboratory department commonly performs CBC testing in the occupational health clinic during a skills check? Option A. Histology only. Option B. Microbiology only. Option C. Hematology. Option D. Blood bank only. The correct answer is option C. Hematology. Hematology evaluates blood cells and commonly performs CBC testing. Histology focuses on tissue specimens rather than routine CBC testing. Microbiology focuses on organisms and cultures. Blood bank focuses on compatibility and transfusion-related testing. Question 96. Before proceeding with the draw, which department usually performs patient and APTT coagulation testing in the blood collection station during a practice drill? Option A. Cytology screening only. Option B. Urinalysis only. Option C. Microbiology culture bench only. Option D. Coagulation or hematology coagulation section. The correct answer is option D. Coagulation or hematology coagulation section. Coagulation testing evaluates clotting pathways and is commonly handled in a coagulation section. Cytology examines cells for diagnostic changes, not standard coagulation studies. Urinalysis focuses on urine specimens. Microbiology culture benches identify organisms rather than routine clotting times. Question 97. During a scenario, which department is most associated with blood cultures in the outpatient clinic during a scenario? Option A. Microbiology. Option B. Chemistry electrolyte analysis only. Option C. Blood bank compatibility only. Option D. Histology tissue processing. The correct answer is option A. Microbiology. Microbiology processes cultures to detect and identify microorganisms. Chemistry analyzes chemical constituents and is not the main culture department. Blood bank testing focuses on transfusion compatibility. Histology processes tissue rather than blood culture bottles. Question 98. In the hospital unit during morning rounds, which department commonly performs type and screen testing? Option A. Parasitology stool testing only. Option B, blood bank or transfusion services. Option C, microbiology only. Option D, chemistry only. The correct answer is option B, blood bank or transfusion services. Blood bank testing supports transfusion safety by determining blood type and antibody screen results. Parasitology stool testing does not perform transfusion compatibility testing. Microbiology focuses on infectious organisms. Chemistry focuses on analytes such as glucose and electrolytes. Question 99. For a blood culture collection, which department commonly analyzes electrolytes such as sodium and potassium? Option A, cytogenetics only. Option B, histology. Option C, chemistry. Option D, blood bank compatibility bench. The correct answer is option C, chemistry. Chemistry measures dissolved analytes such as electrolytes, enzymes, hormones, and metabolites. Cytogenetics focuses on chromosomes or genetic studies, not routine electrolytes. Histology focuses on tissues. Blood bank compatibility testing is not the routine electrolyte section. Question 100. To protect patient safety, which practice is part of phlebotomy quality assurance? Option A, skipping competency checks for experienced staff. Option B, ignoring mislabeled specimens if the patient is well known. Option C, changing tube labels after results are reported. Option D, tracking specimen errors and using corrective action to prevent recurrence. The correct answer is option D, tracking specimen errors and using corrective action to prevent recurrence. Quality assurance identifies errors and improves processes so patients receive reliable results. Competency checks help maintain consistent safe practice for all staff. Familiarity with a patient does not make a mislabeled specimen acceptable. Changing labels after reporting hides errors and compromises traceability.